State government's ongoing budget cuts are now pushing Oklahoma's healthcare system toward collapse. The heads of state healthcare agencies are all facing cuts in services that will cost thousands of Oklahomans access to healthcare. And while there appears to be no chance that the state will ever accept federal funds to expand Medicaid, there may be a way to put that same money toward helping some Oklahomans get healthcare insurance.
The heads of the Oklahoma Healthcare Authority, State Health Department, and Mental Health Department are all facing budget cuts that will directly impact the health care of hundreds of thousands of people, many of them children. Nico Gomez is CEO of the Oklahoma Healthcare Authority, which administers the state's Medicaid plan. Since 2009, over $500 million has been cut from his program. This year alone, that figure increased another $164 million. State government has yet to find a way to fill its impending $1.3 billion budget hole. This year's cuts have already forced the authority to continue reducing reimbursement rates to healthcare providers. But a much larger cut is looming just weeks away as the new fiscal year starts July 1st.
So there could be scenarios where we are having a 17%, 20% cut in our appropriation. I think that's very realistic.
And that would take the agency to near a breaking point.
Then that ends up being a $175 million cut to our program, the state dollars, not including the federal dollars.
Meeting that kind of budget cut would leave 1 million Oklahomans facing the prospect of not being able to get health care.
The reality that I'm facing and that we as a state are facing is if we continue down this path where we continue just to erode for the business side, erode what we can pay providers, there comes a point from an access to care standpoint, if we cannot provide access to care, then why do you have a program?
The Oklahoma Department of Mental Health and Substance Abuse Services is still trying to figure out how to cut more than $20 million out of their current budget. Their first plan was nixed by Governor Fallin, and before they could come up with a new plan, their budget was cut even more. Mental health officials are looking at cuts that could include a loss of prescription drugs for patients and other cuts that will further restrict access to care. At the State Health Department, Health Commissioner Dr. Terry Klein has seen his budget shrink from $75 million in 2009 down to $56 million this year. That has resulted in the elimination of funding to federally qualified health centers, one of the only places people without insurance or money can get health care.
3 years ago, we were not going through that entire pot of money. Year before last was the first year they went through the entire pot of money in the first 3 months of the year. And that shows how much pent-up demand there is in that system.
Also gone is funding for the Cord Blood Bank, various health screens, funding to 5 to 7 county health departments, and funds for child abuse prevention programs.
I spent probably half of my career working with abused and neglected kids in community programs, nonprofit programs, just like the ones we're about to defund.
And there are now 27 counties in the state that have no public health nurses. 90 employees also took retirement this year, and while that will save money, there is still a cost.
And by the way, those are our most experienced, knowledgeable people who have been working in the state, some for decades. So there's going to be a huge brain drain when those individuals leave state service.
The health department is also mandated to inspect nursing homes and veteran centers across the state.
We've eliminated other services to make sure we're putting the resources there, and for the first time this last year, we actually were in full compliance with that. I'm worried about that now, moving forward.
Nico Gomez says all of these cuts will hit rural Oklahoma the hardest.
We're probably more sensitive to rural Oklahoma in this conversation because rural Oklahoma is very dependent on Medicare and Medicaid. We have more covered lives in the state of Oklahoma than anybody.
A new study shows the trend in closures nationwide of rural hospitals is spiking dramatically. The report lists Oklahoma second in the nation for the number of rural hospitals at risk of shutting down. At the Oklahoma Hospital Association, President Craig Jones has been pushing a plan now for several months to accept the federal Medicaid dollars the state has been rejecting and pump it into the Insure Oklahoma plan.
People who are up to 138 100% of the federal poverty level, which is 30-some% higher than what it is right now for those that traditionally are eligible for Medicaid. We believe it would cover somewhere close to 215 to 220,000 more Oklahomans.
About 18,000 Oklahomans are now on Insure Oklahoma, and even with an increase of over 200,000, that would still leave nearly 400,000 Oklahomans with no insurance. Jones says their plan is just a first step in trying to fix Oklahoma's health care system. Healthcare Authority CEO Nico Gomez and State Health Commissioner Dr. Terry Klein are still hopeful that solutions can be found, because without them, the state's entire healthcare system is headed down a bad road.
What you don't want to do is make a decision because of 1 or 2 years of a budget crisis that will have a decade's worth of rebuilding to pick up the pieces.
We are closer to collapse than we've ever been. And that's not meant to be a panic statement. We have to think beyond the next fiscal year. If we continue on this road, this path that we're on, we will drive it to collapse, certainly in certain areas of the state.